Hello everyone, welcome to my YouTube channel Pathology Learning. I am Dr. Monica. So in today's class, we'll be dealing with the autosomal dominant type of Mendelian inheritance. Okay, so this is the next topic under the genetics main series. So already we had seen that autosomal dominant diseases are going to express both in the heterozygous state and also in the homozygous state because it is a dominant allele, right? And then when we see about autosomal dominant disorders, there are certain peculiar characteristics for this autosomal dominant pattern of inheritance. So let's see them one by one. So the first one will be they present in adulthood or adolescence. So the age of presentation of autosomal dominant diseases is going to be adolescence or adulthood. Then we are going to see incomplete penetrance and variable expressivity. So already we had seen what is penetrance and expressivity, right? So this autosomal dominant disorders are going to have both incomplete penetrance and variable expressivity. So what is this incomplete penetrance? Meaning, even though the person has inherited the mutant gene, the mutant allele, so even though they had inherited, they are not going to express the trait. That is the phenotypically they are not going to express it. So that is called as incomplete penetrance. So suppose if I am telling the penetrance is going to be 60%, it means that 60% of the individuals who inherit the mutant allele are going to express the trait. So penetrance is always expressed in percentage. Then coming to the expressivity. So variable expressivity, as the name suggests, there is going to be variable kind of expression. So in this, what does this variable expressivity means is that even though the patient is inheriting the mutant allele and expressing the trait also, so in that case again, the expression of the trait is going to be different between different individuals. So same gene is being mutated, but then different persons are going to express the gene differently. So that is called as variable expressivity. So let me give an example of neurofibromatosis. So neurofibromatosis is an autosomal dominant disorder. So in this gene, in this disease, the gene which is affected is the NF1 gene. So when NF1 gene is being mutated, some people tend to develop cafe-au-lait macules. Okay, so the skin spots called as cafe-au-lait macules are going to be there. Apart from that, certain people are going to develop neurofibromas. Some people will develop bone deformities and some people will develop skin tumors as well. So based on the presentation, it is going to be different for different individuals. So that is what we call it as the variable expressivity. So do not confuse this with the pleiotropy. Pleiotropy as such means that a single gene is being mutated, and the single gene which is going to mutate, it is going to have variable many end effects. So sickle cell anemia was the example for that. So pleiotropy, the sickle cell anemia resulted in the hemolytic anemia picture, and because of that hemolytic anemia, they are going to have variable kind of end effects like bone infarct, splenic infarct. So these kind of different presentation is going to be there. That is the pleiotropy. While variable expressivity is the same gene but different people expressing it differently. That is variable expressivity, right? So let's see about the pedigree charts. So pedigree charts are very important in genetics. So many MCQs come based on this pedigree charts only. So the basics of this is going to be a square is going to represent a male, while a circle is going to represent a female. And suppose I am going to shade this square or a circle. So whatever part is going to be shaded, that means that it is affected. Okay, shading means affected. And if I give a line connecting this square and circle, it means that they are going to be getting married. So that is marriage. Okay. So in this pedigree, if you see, so this part, this square is being shaded, right? So that is the affected male who has married a normal female. So when they are getting married, the chances of them giving birth to a kid with the disease is going to be 50% in autosomal dominant, right? So in this case, if you see, they can have 4 kind of offsprings. In this, 2 kind of offsprings are going to be affected for sure. So out of the 4, it is going to be half of them which are going to be affected, half of them who are not going to be affected. And the other thing, if you see from this pedigree chart, is that every generation is being affected. So there is no generation skipping, every generation is going to be affected. And also this is a square, this is a circle, right? So both square and circles are being shaded, meaning both male and females can be affected. So let me put this in simpler terms. So here in autosomal dominant diseases, all generations are going to be affected. So all generations are being affected, meaning at least one parent is going to be affected, right? If all generations are affected, obviously one of the parents is going to be definitely affected. So all at least one parent should be affected in autosomal dominant diseases, and all genders can be affected. No gender bias is going to be there because it is not a sex-linked disease, right? And then every child is going to have a 50% chance of developing the disease. Out of the two, at least one child is going to be affected. So that is what I mean by 50% chance. So this is an important MCQ. So let us not mug it up. I'll put it in much more simpler terms now. So I am going to represent a dominant allele by the letter capital. Okay. So capital A, small a is going to represent the affected parent. So the affected parent is going to marry a normal parent who is going to be represented by AA allele. Okay. So if I put the combinations for this, what will be the combinations? So this A, capital A with the small a is going to form capital A, small a. Then this A with the small a, again it's going to form capital A, small a. Then this small a with this small a is going to form small a, small a. And this small a with this other small a is going to form AA. So in that case, this capital A has come in two possibilities, right? So out of the 4, 2 people are going to have the chance of developing the disease. That is why I call it as 50% chance, while these 2 are going to be normal. Okay. So even though it is in a heterozygous state, being an autosomal dominant disease always expressed both in the homozygous and the heterozygous state. That is why capital A, small a is also going to be affected. Okay. Now let's see about the diseases which can be caused by this autosomal dominant pattern of inheritance. Usually if you say it is the structural protein defects which are the most common diseases in the autosomal dominant pattern of inheritance. So examples of the structural protein will be collagen, again a main connective tissue. So collagen is a structural protein. Then we have spectrin, ankyrin. So spectrin and ankyrin, these actually are structural proteins present on the RBC cell membrane. So any of these proteins can be affected. Other than that, we have many other structural proteins as well. So in any of the structural proteins getting affected, they usually have a autosomal dominant pattern of inheritance. So for example, this ankyrin, when it is mutated, it is going to result in hereditary spherocytosis. So hereditary spherocytosis is actually a autosomal dominant disorder. Then coming to collagen. So collagen can be affected in various diseases. Examples of this is going to be Ehlers-Danlos syndrome, EDS is Ehlers-Danlos syndrome. Then we have osteogenesis imperfecta. So even though Ehlers-Danlos syndrome is going to have various patterns of inheritance, the most common pattern is going to be the autosomal dominant pattern only. Okay, EDS has both autosomal dominant and autosomal recessive pattern of inheritance, but most common is autosomal dominant. So there is something I want to stress here, which is called as the dominant negative effect. So dominant negative means even though there is going to be a normal protein which is present, so even the this mutant allele, whenever it is present, it is going to cause the it is going to deprive the normal protein being formed. So let me give an example for this. So here again we can take the example of this osteogenesis imperfecta. So in this osteogenesis imperfecta, collagen is going to be defective. So collagen, we all know it is a triple helix. So each of the helix, the subunits are going to be formed by a different gene. So if one of the subunits is defective, still the normal collagen, that is a triple helix, cannot be formed. So what does that mean? Even though the other 2 helices are normal, this one subunit which is abnormal is going to prevent the formation of the normal helix, normal structure of the collagen. So that is what we call it as dominant negative. That is, the dominant allele which was mutated is having this negative effect on the normal proteins as well. So that is what is called as the dominant negative effect. Okay. So this dominant negative effect can also be seen in Marfan syndrome, osteogenesis imperfecta, even in Ehlers-Danlos syndrome. Okay. So let's now move on to the examples of this autosomal dominant disorders. So this again are very important MCQs. They can directly ask as an one-liner also. So to remember this, I have you can use this simple mnemonic, which is he has a very dominant father. Okay. So out of this he stands for hereditary spherocytosis. So as I mentioned, it is a RBC membrane defect wherein ankyrin is going to be defective, which is a structural protein, right? So it is Huntington disease. So Huntington disease, here it is a neurodegenerative disorder. We will be seeing in detail in the CNS chapter. Then A for achondroplasia. So achondroplasia, the classical history which will be given is the patients are of very short stature. Then very V for von Willebrand disease and also von Hippel-Lindau syndrome, VHL syndrome and von Willebrand disease. Then D for myotonic dystrophy. So myotonic dystrophy is for D. Then O for osteogenesis imperfecta, M for Marfan syndrome, I for acute intermittent porphyria, N for neurofibromatosis 1 and 2, both NF1 and 2 are autosomal dominant. Then A for autosomal dominant polycystic kidney disease. Then T for tuberous sclerosis. Then F for familial adenomatous polyposis, in which there is going to be multiple colonic polyps which are formed and they are precancerous. They can develop into colonic cancer. Then we have Lee-Fromeny syndrome. So F again. So Lee-Fromeny syndrome is one in which p53 gene is going to be mutated. So when p53 is gone, it is going to result in n number of cancers. So that is under the Lee-Fromeny syndrome. So that is again a autosomal dominant disorder. Then we have familial hypercholesterolemia. So familial hypercholesterolemia, even though most of the inborn errors of metabolism usually come up under the autosomal recessive pattern of inheritance, familial hypercholesterolemia is one exception in which there is going to be autosomal dominant pattern of inheritance. So the cholesterol levels of these patients are going to be very high, and then there is going to be increased risk of developing atherosclerosis and coronary artery disease in these patients. So here as such, the LDL receptor is the main defect. Okay, so we'll be seeing about some of these details in the some of these diseases in the upcoming videos in detail. Okay, so that's it for today's video. So if you like my content, consider subscribing and sharing it to your friends who might also benefit from my videos. Thank you once again.